Diabetes Type 2 by
Ellie.
Ysreal.
Biddy.
And Jeisson.
Let's talk about the etymology and definition of the word diabetes mellitus. From the Greek word diabetes meaning to siphon and from the Latin word mellitus meaning sweet or honey, diabetes type 2, also known as insulin-resistant diabetes, is a progressive disorder in which body cells become less responsive to insulin, therefore causing hyperglycemia. Hyperglycemia is a condition in which an excessive amount of blood glucose circulates in the blood plasma.
Risk factors of diabetes type 2: diet, obesity, race, ethnicity, age 40 to 45 years, increases with age, rising in children age 0 to 18. Symptoms of diabetes type 2: reduced blood supply, hypertension, heart diseases, stroke, nerve damage, polydipsia, that is increased thirst, polyuria, that is increased urination, polyphagia, that is increased hunger, and blindness.
In normal homeostasis, as food is digested, blood glucose levels increase. Blood glucose levels are detected in the pancreas by beta cells which release insulin. Insulin targets liver cells to store glucose in the form of glycogen. Insulin travels through the blood and targets body cells to use glucose as a source of energy. As glucose levels decrease, insulin release stops, resulting in a negative feedback. Blood glucose levels return to normal.
Now we look at the abnormal homeostasis loop, which begins with introducing glucose to the bloodstream. This is usually done by either eating food or drinking. From here we move to the pancreas. In the pancreas are beta cells, and the job of the beta cell is to release insulin. The insulin is then moved to the rest of the body. And there are two main targets affected, which are the muscles and the liver. Cells in the muscle and liver receive less glucose. This is due to the body cells developing insulin resistance. With less glucose going into the body, that means that there is less glycogen being made, and there is a less of an energy source to be used. Now we look at the concept of insulin resistance. The insulin released from the beta cells of the pancreas make their way towards cells, and on the cell membranes are insulin receptors. The insulin will attach to the insulin receptor, which will notify GLUT4. The GLUT4 then moves towards the top of the cell membrane to allow glucose to enter the cell. From here they are either converted into glycogen or simply used as energy. Now we look at how GLUT4 is altered during diabetes type 2. The insulin released from the beta cells still make their way to the cells and try to attach to the insulin receptors. However, the chain reaction that usually occurs is altered. The insulin is accepted, GLUT4 is released, but the GLUT4 does not accept as much glucose anymore into the cell. Less glucose means less glycogen to be used as energy.
Treatment and prevention. There is no cure for diabetes type 2, but it can be managed or prevented by diet. Eat out less, eat foods with less sugar, foods that are sugar-free, or try and use the sugar substitutes such as Splenda. Exercise. Exercise will help with obesity and encourage cell use of glucose. In summary, the three main risk factors of diabetes type 2 is obesity, diet, and genetics. The main symptoms are nerve damage, polydipsia or increased thirst, polyphagia or increased hunger, polyuria, increased urine, and stroke. Abnormal homeostasis is when the insulin receptor does not cause GLUT4 vesicles to move up and bind to the cell membrane. The glucose is left in the bloodstream, causing an increase in blood glucose levels. Insulin continues to be released until beta cells of the pancreas are exhausted. When insulin hits the receptor on the cell membrane, it triggers a series of proteins that ultimately lead to the movement of vesicles, containing the glucose transporter GLUT4, which is a protein, to move to the surface of the cell membrane. This allows glucose to move from the ECF to the ICF. The body system affected by diabetes type 2 are the endocrine system, the cardiovascular system, the urinary system, and the digestive system. Diabetes type 2 can be managed by diet and exercise.